The 12-lead electrocardiogram, one of the most common and important tests used to assess heart health. This simple non-invasive test helps doctors evaluate the heart's rhythm and overall function in just a few seconds. The 12-lead electrocardiogram is a painless, non-invasive test that records your heart's electrical activity from 12 different directions called leads. This gives a complete three-dimensional picture of your heart's electrical signals, allowing doctors to check your heart rate, rhythm, and electrical access, and to detect issues like heart attacks, arrhythmias, hypertrophy, and even electrolyte imbalance. The ECG is used in many clinical situations, such as diagnostic investigation for symptoms like chest pain, palpitations, fainting, or shortness of breath. Monitoring for patients with existing conditions like heart failure, arrhythmias, or post-heart attack recovery. Pre-operative screening before surgeries, especially in older patients or those with heart risk factors. Risk screening for people with hypertension, diabetes, high cholesterol, or a family history of early heart disease. In short, it's a vital tool for both the detection and prevention of heart problems. An ECG is very safe. There are no absolute contraindications, meaning almost anyone can have one. However, healthcare professionals follow certain precautions. Firstly, to ensure the patient's skin is clean and not irritated. Second, maintain comfort and modesty during the procedure. Third, never leave a critically ill patient unattended. And lastly, always verify that the patient is clinically stable before starting. These small steps ensure both accuracy and patient safety. Before your ECG, there are a few simple things to keep in mind. First, avoid using lotions or oils on your skin. These can interfere with how well the electrodes stick and pick up signals. Next, wear comfortable clothing that allows easy access to your chest, wrists, and ankles. Also try to stay relaxed and avoid heavy activity or exposure to cold temperatures right before the test. And finally, remember that ECG is completely painless. It only takes about 10 to 15 seconds, and you just need to stay still and breathe normally while it's being recorded. Now let's take a look at what happens during the test. You'll be asked to lie down on an examination bed, ideally flat, but if you can't, a semi-upright position is fine. The technician will clean the skin and may clip a small amount of chest hair to help the electrodes stick better. Next, 10 electrodes are placed, 4 on your limbs and 6 across your chest in specific positions. The chest electrodes are arranged as follows. V1 is on the right side of the sternum at the 4th intercostal space. V2 mirrors V1 on the left side. V4 lies on the 5th intercostal space at the mid-clavicular line. V5 sits at the same level as V4 along the anterior axillary line, and V6 is at the same level on the mid-axillary line. V3 is placed midway between V2 and V4. These precise placements help capture the heart's electrical activity from different angles, producing a complete and accurate ECG recordings. Once all electrodes are in place, the recording begins. During this short period, remember 3 key points. Stay still, breathe normally, and avoid talking. Even small movements can cause artifacts, which may affect the accuracy of the results. The entire process takes only about 10 to 15 seconds, and once a clear tracing is captured, the test is done. After the recording, the electrodes are carefully removed, and any leftover gel or adhesive is wiped off. There's no downtime after the procedure. You can immediately return to your usual activities and continue taking your medications as normal. Next, the ECG printout is labeled with your details, such as your name, the date, and the time of the test. A qualified clinician will then review and interpret the tracing, looking for any signs of abnormal heart rhythm or other findings. Finally, the results are discussed during a follow-up consultation where your healthcare provider explains what they mean and, if necessary, outlines the next steps for your care. Before we end, let's highlight the key points. First, the 12-lead ECG is a simple, low-cost, and non-invasive tool that is essential in diagnosing heart conditions. Second, it helps identify a wide range of issues, including heart attacks, arrhythmias, and other cardiac or systemic conditions. Third, from the patient's perspective, the ECG is quick, painless, and completely safe, requiring only cooperation for a few seconds. And finally, for healthcare professionals, a strong understanding of the ECG's indications, proper technique, and patient preparation is vital for accurate and reliable results. In short, the ECG may be a simple test, but it plays a critical role in keeping our hearts healthy.